I'm Kersi Chavda. I'm a psychiatrist associated with 3 corporate hospitals in Mumbai. I'm going to be talking with PharmEasy on various issues related to mental health and diabetes. To begin with, it's a fairly common disorder. People do read about it, people have heard about it, and they are aware of complications associated with diabetes. So what are these complications? They could affect any part of the body, and because of these complications, people get very frightened. Often we have somebody who has diabetes within the family, or we know somebody who has diabetes. This whole thing of carrying a biscuit around with you is very well known. What we need to be aware of the fact that it's a chronic illness. People get very frightened when they think about it. People have also today Googled and found a whole bunch of things which may be misconceptions relating to the disorder, which may be making them feel very, very frightened and give them the kind of heebie-jeebies, which is not really necessary in such a situation. I think it's extremely important for us to be balanced when we know we have this disorder, because yes, diabetes does cause problems, but certainly can be controlled, and you can live an absolutely normal life given some things that you look after. So diabetes can hit you when you're a kid, can hit you when you're a teenager. You can have diabetes when you're an older person. Diabetes can be comorbid with a mental disorder, which means it can occur along with a mental disorder. It might also occur in reaction to something that has been triggered off by some of the medication. Whenever you have diabetes, it's difficult because to begin with, it makes you feel vulnerable. None of us like growing up with the idea that we have a disorder for which we have to, restrict maybe our diet, go regularly for exercise. We might enjoy dieting, we might enjoy exercising, but when we are told we have to do it, otherwise there'll be complications, there's often a resistance. Some of us might have seen diabetes within the family because it's known to run in families. And if you've seen a hypoglycemic attack, where basically the person, his sugar levels fall, and he starts feeling scared, he starts feeling nauseous, he might have a blackout. It's a very frightening thing. When you're a kid and you have diabetes, there are lots of restrictions, and it's not easy for a kid to go to maybe a birthday party and not indulge in having cokes and cakes. It becomes very difficult. As an adult, very often if you're diabetic, you'll end up getting depressed, you'll end up getting anxious. There may be sexual side effects, there may be neurological, cardiac side effects, and all of these actually impinge on the quality of work of your life. What we must remember, however, is that if we can look after ourselves, if we are sensible about diet, take the medication properly, go to a proper diabetologist, then it's very easy for us to control, by and large, what is happening to us in terms of our blood sugars.